Hello, my name is Dr. Jason Mazzarella. We are now offering the most advanced, research-based continuing education seminar on whiplash in the world. This program is CME accredited, CCE accredited. It is accredited in 29 countries. It is also the only program in the world that is accredited for CE for every major health profession that treats and assesses whiplash injuries, including medical doctors, doctors of osteopathic medicine, doctors of chiropractic, physical therapists, and RMTs. There has never been a continuing education program as well recognized or accepted on whiplash. Harvard Medical School stated, "This program provides education on a topic that is not currently represented in our education." The only way we can fill this educational gap is by developing a world-class seminar series based on the most up-to-date research and best clinical practice methods, and that is just what we did. Our goal is to fill this educational need, and we intend to do so through a three-step process. First, providing world-class seminars to teach healthcare providers how to assess and treat whiplash injuries. Secondly, provide professional guidelines that are based on the most current research and are specific to whiplash injuries. And third, provide professional acknowledgement for those doctors who have attended these courses and who now have a better understanding of how to treat and assess whiplash injuries. Whiplash guidelines. Currently, our industry uses either the Quebec Task Force on Whiplash-Associated Disorder Guidelines or the CROF Guidelines. The QTF is based off of research completed before 1993, and none of the authors had any significant clinical experience treating whiplash. They were paid for by the insurance industry, and their acceptance was due to a publication in the Journal of Spine. There was no academic endorsement for any chiropractic or medical school. The CROF guidelines were developed by Arthur Croft, a leader in the field of whiplash, but they were specific to chiropractic care and also published in the 1990s. These guidelines were also accepted by a Canadian Chiropractic Association, but there is no academic endorsement from any chiropractic or medical school. In fact, during Dr. Croft's seminars, he stated that the authors of the QTF actually used his guidelines to develop the WAD guidelines, as one of the journal peer reviewers for his guidelines was an author of the QTF. The Mazzarella North American Spine Institute guidelines are based on the most up-to-date research, with research as recent as January 2022. This month, they are also based on my experience treating over 40,000 whiplash patients in clinic, reviewing tens of thousands of research articles on whiplash and associated disorders, and include trauma considerations that we did not associate with whiplash in the 1990s, but now know better, such as vestibular injuries, cranial nerve injuries, concussions, neuropathies, and traumatic stress. These guidelines also discussed in my upcoming seminar series, which is academically endorsed in 29 countries by both the medical and chiropractic universities. There is currently no postgraduate educational acknowledgement in whiplash. There are several organizations that suggest certifications in surrounding topics such as CAD assessments and medical legal concepts, but these are not backed by any medical or chiropractic university. Even the AMA guidelines for impairment certifications are not sponsored, endorsed, or accredited by the AMA. So whiplash needs a credential that is based on an educational material that is backed by medical and chiropractic schools. Our credentialing is a mark of approval by the North American Spine Institute, which is internationally accredited by medical schools and chiropractic schools for whiplash continuing education in 29 countries. This credentialing indicates that the attendee has achieved recommended standards of professional development and experience in whiplash traumatology and treatment, including an understanding of best practice, clinical practice assessment, and treatment guidelines. On our website, you can click on CE Seminars. Under CE Seminars, we have information on the universities that are accrediting and sponsoring our program, and you can click on the links to go to those university pages. We have a registration button if you'd like to register for the seminar. And we have information about our diplomat program, which you can click on and read more, as well as our clinical practice guidelines, including all particulars of the guideline, and a comparison between our guidelines and the Quebec Task Force guidelines. We have 4 modules in our program. Module 1 discusses crash forensics, trauma-associated sequela, accident reconstruction, and crash data retrieval. We will show you live crash testing and explain how we can determine injury patterns based off of a collision vector and principal direction of force, with considerations of occupant risk factors. We will also discuss common associated traumas such as the reverse S-curve, traumatic stress, fatty infiltration, and PTSD. We will end Module 1 with a primer on accident reconstruction and crash data retrieval. Module 2 discusses physical examination, which includes specific examination procedures to perform on pain topics such as receptive field enlargement and referral patterns, and common syndromes such as TMJ, vestibular disorders, concussions, cranial nerve injuries, and neuropathies. Many may be surprised to know that these common syndromes are found in almost every single injured patient. We just don't know what to look for, and our program will teach you how to evaluate for these injuries through physical examinations and special testing. Module 3 concentrates on the neurophysiology of whiplash, including special testing with QEEG, SEMG, and postureography testing. We will discuss how you can use these special tests to evaluate for concussions, neuropathies, and chronic pain. Module 4 will discuss best practice treatment options, special tests such as MRI, CT, ultrasound, and video thoracoscopy, and also what to look for in these tests. Finally, we will conclude the seminar with a med-legal primer that includes how to write and reference a Whiplash Traumatology medical legal report. Typically, IRME reports with special tests are generally between 70 and 100 pages, and we will show you what to include to provide the most comprehensive report on the market.